Yes, sir. But I'm gonna admit everyone now.
Okay.
Awesome. Good morning, everyone, and happy Saturday or Sabbath if you celebrate. Welcome to another episode or another session of iLearn Saturday with Cassange Bitère. We're going to give people at least maybe a 5 minutes delay. That way people can just like walk in or trickle in. And in the meantime, what you can do is grab some water, a notebook, and a pen, and just wait for other participants to come in by 11:05. Okay. Cassange, it is 11:05. The
Thank you.
floor
Thank you,
is
Debbie. Good
yours.
morning, everyone. Thank you. Good morning, everyone. Welcome to this session. So just before we start, I think I have to present myself, to introduce myself actually. So basically, who am I? My name is Cassange Bitère. I've been working in global development since 2019, I think like 6 years or 7 years now, I think. And I've had like the chance to support different programs in different countries, such as Haiti, which is my home country, and in part of West Africa as well in East Africa. And in terms of education, I do have a master's degree in development practices, and my main focus or specialization is in monitoring and evaluation. I do also have a specialization in global health and well-being. So basically, what I do is like helping organizations to understand what's working within their program, what's not working, how to improve their programs as well. And I've also worked in global health and well-being. I studied in Haiti, supporting HIV prevention and treatment program. And in the US, I've been doing research on well-being among Black people, mainly in Metro Atlanta. But I kind of have like an interest in well-being because of that research actually, and mostly to help people who are impacted by like health. So that's basically what I do for work. And I can say beyond monitoring and evaluation and research work, I do also provide training, and that's what I'm going to be doing today with you. So basically, that's an overview of who I am. And for our agenda today, we will be discussing at first our learning objective for this session, and then we'll go over the foundation of data collection, which kind of means
Was only
the
1 minute.
main,
Yay!
sorry, someone was saying something.
I think it was just an accident. Go ahead.
So yeah, then we'll go through the foundation of data collection, which means like the different type of like the two main different type of data that we work with in monitoring and evaluation. And after that, we will kind of explore the data collection techniques that you can use and how to choose the right technique for your context. And we'll also talk about data quality and cover some ethical considerations when doing data collection. And we'll have like a Q&A session and we'll wrap up the training for today. Oh, by the way, in terms of questions, since we'll have a Q&A session at the end of the session, so if someone has a question during the what I'm presenting, you can put the question in the chat and maybe we can address that later. Or if you want to wait until the end so you can unmute yourself and talk, we would be happy to hear from you as well. So in terms of learning objectives for today, what I do expect for you is that you will be able to identify different types of data, which means like quantitative data and qualitative data, be able to recognize various data collection techniques in data relevant for monitoring and evaluation, understand the strengths and weaknesses or limitations of different data collection methods, be able to select appropriate data collection techniques for your monitoring and evaluation or objective and context, and also to kind of appreciate the importance of data quality and ethical considerations in monitoring in data collection, actually. So just before we jump into the specific techniques, it's really important to know what we actually mean by data in monitoring and evaluation. So when we talk about data in monitoring and evaluation, what we mean is that we are referring to any kind of information that kind of help us to track our progress, measure outcomes, and understand whether the program is working or is making progress or is impacting people as we hope for the program to do. And data also helps us to answer big questions like what's working, what's not working, what needs to be done, and what needs to be changed. Now, in M&E, data actually falls into two main categories. And first, we do have quantitative data. This is the kind of data that comes with numbers. For example, we might be trying to collect data that are in terms of percentages, count of participants that have been part of a training, test results, and things that we can actually measure in terms of numbers and analyze statistically. Then we do have qualitative data, which is more about words and meaning. This comes from interviews, focus group discussions, sometimes observations as well, and so on. There are different techniques to actually collect data that are qualitative or descriptive. This type of data also helps us to understand the why behind the numbers and understand people's experience, beliefs, and behaviors. However, both types of data are really important for monitoring evaluation. They offer like different perspectives, and when you use them together, you get a much more completed and nuanced picture of your program's performance. So let's start with quantitative data. As I said earlier, this is a type of data that is all about numbers. It answers questions like how many, how much, or how often, and they are that you can actually count, measure, and analyze statistically. One of the strengths of quantitative data is that it is really objective and it's easy to present visually. Like you can see in the graph, see in the image, the graph. You usually present quantitative data through charts or tables, which gives you a clear, measurable way to track progress over time. So in monitoring and evaluation, quantitative data is used all the time for example, we use it to track numbers. Not just numbers, but for example, if you are doing training and you need to know how many people have been trained through your trainings, you use quantitative data to actually have that measurement and also to calculate percentage if someone's like, for example, you're trying to understand in a household, how income has changed in this household, you use quantitative data to do so, and you do present that in via charts or tables as well. So basically, this is for quantitative data. However, if you want to understand the why behind the numbers that you gather from the quantitative data, you need to complement that with qualitative data. And qualitative data actually helps you to understand the reasoning behind the results that you have through quantitative data. And as I said, it is really descriptive. It captures people's experience, perceptions, and emotions as well sometimes, and also behaviors. Instead of like giving us a count of percentage, it actually gives us stories, themes, and context to better understand what the numbers are telling us. And actually, this type of qualitative data is often collected through interviews, focus group discussions, and sometimes through observations as well. And they can be like videos, transcripts, and things that need to be interpreted rather than like just calculated. And as you can see in this example here, this is some type of, I don't know if it's clear on your side, but this is some type of quantitative data. And for the first paragraph, you see it says, despite the challenges, some participants saw opportunities for empowerment within the Black community in Atlanta. And CM05 means the participant. We don't use the participant name. We use a code to refer to the participant. CM05 suggested that because the city's large Black population, there is a potential for stronger advocacy and community-driven change. So this is the type of interpretation we are able to do through qualitative data someone shared with us, a participant shared with us. And what the participant shared with us was, despite everything, I still think Atlanta provides more opportunities for Black Americans compared to other cities. You see people who look like you doing well and make change and make difference. So this is what the participant told us, and we are able to interpret what they say. And to support our interpretation, we use a quote from what the participant has told us to support our interpretation. So now we're going to cover the categories of data, which not the categories of data, but we're going to discuss the different data collection techniques, which is the main goal of this session today. But something I really want to emphasize on here is that data collection is like really the foundation of effective monitoring and evaluation. And without that, we are just like guessing. We wouldn't be able to know what's working within our project or programs and where we do have gaps and how to improve the program as well. We won't have that information without data collection. So when we collect data well, it helps us to do like three main things. And the first one would be to track progress. Are we moving in the right direction with our program or project? And the second one is help us to assess our outcomes. What are we achieving through this program? And the third one is kind of like to provide some type of evidence that we need to make better decision about the program, such as like funding and policy and things that can actually help us to improve the program. And in like when we talk about collecting data, we usually gather it from like two main sources. And those sources are like primary data source and secondary data source. Um, Primary data is information that you actually collect directly from the sources. Like this means like you design the tools, asking the questions and gathering the response firsthand. It is like you tailor specific, you tailor like your tools specifically for evaluation and you collect the data from the sources directly. You don't use data that was already there. On the other hand, we do have the secondary data. That is like information that someone else has already collected. So that information already exists. They might be like government report or government statistics, previous research or studies. And they can also be within your organization, but another project or another person had already collected this data, but you can actually use it for your report or for your evaluation. Both types of data have their like own place. The primary data gives you like control and specificity, but it also takes you time and more time and resources actually. Whereas the secondary data is a way quicker approach to use and often free. You don't really spend too much resources on when you're doing the secondary data collection. But most of the time, it may not be like the exact um, approach for you to use because it won't really provide current data or the data that you are actually collecting through secondary data might be outdated. So that's the downside of the secondary data collection. But when do you actually use primary data collection and secondary data collection? As you can see here on this slide, you will want to collect primary data when the data hasn't existed before. So that information is not there, so you cannot find it. So you need to actually collect the data yourself. Or when you need something that is very context specific or current, like it is more recent. It is also best to collect data when you want to have control over the data that you want to evaluate the project. And what I mean by that is like, for example, if there are like specific questions that you want to ask to your participants and you don't really think that, and even though those information exists somewhere else, but you don't really think it's relevant to your evaluation plan or your evaluation goal, you actually want to collect primary data from from the source itself. So you don't really use primary data for that. And also, it is really important to collect primary data when you like exploring sensitive topics such as stigma around something, or let's say you're collecting data around something that is related to gender norms in some communities. They are very sensitive topics, so you cannot really use secondary data. So you need to talk directly to that participant, have a private conversation with them, which is like in-depth interviews or key informant interviews as well to collect this data. But on the flip side, for the secondary data, it is really great when time or budget is really tight for you. For example, you might need to, let's say your donor reaches out to you and say, hey, we need a report on the progress of the program that we are paying for, that we are funding. And they only give you like 2 weeks or a month, and it's really tight for you to actually collect data, primary data to give them that report. So you're actually going to use secondary data to to actually provide that evaluation report to your donor. However, you also can use secondary data when data that already exists is relevant to evaluation plan or evaluation goal or evaluation questions. So you can also collect that secondary data for that. So you like you can really do that in a very short period of time, and you don't really need a lot of budget for to actually collect this data and use. And most of the time, there are projects or organizations that collect data for benchmarking and trend analysis. And what I mean by that is like they are trying to compare their work or performance to, to like a standard or to another organization that is doing the same work as them as well. And they do also collect secondary data to triangulate information. For example, you did collect data from the primary sources, but actually you want to compare the data that you have from your primary sources to data that was already collected. You do have to collect secondary data to make that triangulation as well. But one thing I wanted to for you to keep in mind is that a strong evaluation project often use a combination of primary and secondary data because that actually helps them to understand their actual results from their baseline results. So that's why in evaluation project they usually use um, both main sources of data collection. But in the process of collecting data and to be able to collect the right data, you also need to understand what you're measuring. And that's where it is really important to have a theory of change. So what I mean by we had a session on theory of change, I think last year, and I will be sharing the link to that session at the end of the training for everybody who would like to have a deeper understanding of what a theory of change is. But to effectively collect data for monitoring and evaluation, your project team need to develop a theory of change, which is a process that is integrated while the program is being designed. Um, so the way I want you to think about the theory of change is like it is a roadmap of your project, and it's a way of explaining how you believe your project will, your project activities will actually lead to changes and will actually lead to the impact that you want to see after your project is completed. So instead of like listing what you will do, the theory of change actually shows you a logical sequence of how you're going to do it. So what it does for you, it connects everything that you have to the bigger impact that you want to see. So it connects your resources to your activities, and resources is usually like funding, money, staff, and activities of maybe like training, distribution of certain like equipment or something like that. It depends on the scope of your project. Actually, they're not really specific. What I can say it's most likely specific is funding. Money is always important in projects. So in resources, you will always see funding as well. But it also depends on the scope of your project. But sometimes there are projects that you don't even need money, but it depends on the scope. But it's like maybe 10% of the project most of the time. So what it does is like it collects your resources, your money to your activities, and your activities. After completing your activities, you do have certain outputs. For example, outputs may be number of people that have been trained through your trainings, and outcomes may be like increased knowledge because of the training. People have more knowledge about certain like health techniques, health issues and stuff like that. So this is basically what the theory of change does for you. And other thing that the theory of change allows the team to do is to develop certain metrics, which we always refer to as KPI, key performance indicators, to help you to track your progress. So the way I want you to think about your KPIs, they are like, everybody like us, we do have vital signs. The KPIs are the vital signs of the project. And they are like specific things that we're going to measure to see if we're making progress towards our goal. For example, if your goal is to improve farming practices in the community, a KPI might be something like the percentage of farmers that are adopting the new techniques that you're trying to implement in that community. So it is important that our KPIs are really well defined, which means like really specific. We are able to count or quantify them, which is like measurable, and you are able to kind of like attain your goal given the resources that you have, which is the achievable. And also, it actually tells you something important about your progress, which is the relevancy of your KPIs. And you do have certain timelines and deadline for your KPI as well, which is a time bound. So it's very important to define your KPI to be really smart. So in the process of collecting data in monitoring and evaluation, you need to be able to differentiate if you're collecting monitoring data or evaluation data, because even though both monitoring and evaluation, they do work together, and they involve data collection, their purposes is really, and also their techniques, they are really different. They are not the same at all. For monitoring, it's about making sure that your project is happening as planned. That's why teams usually use quick and repairable tools like checklists, logs, or mobile survey because they need real-time information to make quick adjustments. And these data collection techniques are usually built into like the regular activities of the project and are usually done by the program staff directly. So they don't have an external evaluator to collect this data for them. But when it comes to evaluation, we are stepping way back and asking like, did this work? What changed? What has changed with that program? Why or why not? You know, these are the type of question that you're asking, and this is where the evaluation part is really important. It requires like a deeper tool to understand the why behind the numbers. And you do have certain tools like surveys, in-depth interviews, and focus group discussion as well that kind of explores the perceptions and impacts of the project as well and people as well. And it's evaluation is not really like you don't do evaluation on a daily basis compared to monitoring. You do evaluation um I would say episodically, like for example, you might do like a mid-evaluation during your project. Let's say you have a project for 2 years, so you would maybe want to do an evaluation at the end of the first year and another evaluation at the end of the second year. So the one you do at the end of the first year, you would call it like the midway or midline evaluation, and the one at the end of the second year will be your endline evaluation. But it also depends on the project because some projects will do like two evaluations a year. So it depends on the team, it depends on the availability of your program staff, your time, your budget, and stuff like that. But one thing is that the evaluation part, they put more rigor in it, so it's really important to kind of focus on the evaluation part because it will give you data that you can actually use to understand why your project is working and or why it's not working, and to actually learn lesson that can help you make adjustment in the meantime, I mean within the time period of your project. And also the type of data changes between monitoring and evaluation. For the monitoring part, the data that you will have are usually like the number of people you have been able to impact, and the evaluation part will tell you how your program has impacted the people. The evaluation part will give you information about like what what those people have been able to do because of this project, you know, and things like that. So this is why it's really important to have both together. I mean, both combined, but you cannot like collect data for monitoring to also do an evaluation. They are like very separate. And here, this is an example. I was working on a project with a professor 2 years ago, I think, and we're trying to develop a project on the implementation of an injection treatment for HIV prevention and treatment in Haitian prisons in Haiti. So we have been able to develop a table of indicators. I'm not gonna say this is like the most perfect table of indicators, and there's no such thing in monitoring and evaluation. You don't have like a perfect theory of change. You don't have like a perfect table of indicators because all the time, all the way your project is ongoing, you might need to make some change as well. So in this table, we don't just put our KPIs to track our progress and to understand how our project is working. We map out each of our KPIs with specific data source and data collection tool. And this is really critical because to collect meaningful data, you have to first know what you're measuring and also where the data is being stored. And how you will go and get this data as well. For example, if you're looking here, like one of our indicators is the number of HIV care providers being trained. You'll need the training records as data source, like to get the data to know how many people have been trained, how many HIV care providers have been trained. You need the training record to actually have the data for this indicator. That means your data collection techniques could involve like routine document review or certain data collection from like attendance logs, from like I think the Ministry of Health, which is like where the data is being stored. If your indicator is about patient behavior, like the number of people who switch from LAI-ART is the name of the injection, which means long-acting injection for antiretroviral therapy. You'll likely need to collect primary data. And by primary data, I mean you're going directly to the source. And you might need to conduct like structured interviews or interviews with the patient directly. I think in the short-term outcomes here, you see like the indicator is number of people living with HIV who receive training or information about LAI-ART. And the way we collect this data is through survey. And the data collection tools we're going to use is patient survey. So you already know exactly what technique you're going to use to collect this data, to collect this information in order for you to be able to do your evaluation. So um, in summary, I would say this table actually guides you from like the different part of your TOC, like your activities, your outputs, your outcome. It kind of guides you how what the indicator is, how you're going to measure it, what it means, and how often you're going to measure it as well. As you can see here, the frequency part, they are like quarterly, annually, monthly, monthly, quarterly, and etc. So you do have all this information, so you know exactly when to collect the data. You know exactly what your target is. You know exactly who is responsible for the data collection, the responsibility part. You see it here, the ministry staff, and here you see training facilitators, the one collecting the data for you. You see like logistics officer, etc. So you do have all this information, and this is the best way to kind of have like to kind of really own the project and understand exactly how you're going to collect this data, how you're going to do your monitoring, how you're going to do your evaluation. So in this slide, I kind of like zoom in on some of the most common techniques that we use in that process. So in the table that we reviewed earlier, many of the indicators, especially those under the activities and outputs, they rely on data that comes from like routine sources like service routine activities and stuff like that. They're like records that already exist. So we're not going to collect the data from the source itself. We do have the information existing. So we do like a documentation review, some type of like secondary data collection to have this information. And another um, technique that they use a lot is observation, which was not in the table, but it is often used in monitoring to assess how activities are being implemented on the ground, and especially like supervision and implementation quality was involved in the project. So this could mean like you do have certain checklists during the site visit to assess whether protocols are being followed or whether like the facility are being properly equipped with the equipment that you have sent, that you have distributed within your project, through your project. And one other technique that we use as well, or like cases like checking patients' experience or behavior, like team kind of like use mobile survey through, like they use tools like Kobo Toolbox, like Google Forms, and one I've recently discovered, which is called Solstice, that can really help you to gather data directly from beneficiaries, especially when you need to have like quick feedback across like multiple sites or multiple areas. I'm not sure yet if Kobo Toolbox offers this, but I think Solstice does because I've used it myself. What it allows you to do, as long as you have the Solstice application on your phone, you don't need internet connection to collect data. So you go directly to a remote area where maybe you don't have access to internet connection. You can still collect the data that you need from the participant. You put all the information on the Solstice. It will save the information for you. And once you have the internet access, you do validate that information you collected on the ground, on the field, actually, and then everybody else that is working on this project will have this data available for their analysis. And one other tools that they use is feedback mechanisms like suggestion boxes and hotlines as well. And those are really crucial, especially with organizations I work with. They use that a lot. They allow you to kind of hear directly from the participants in a way that like that is not really formal or that is not structured, but it is really valuable to identify certain gaps that you are not able to identify while you are collecting your data. And most of the time they use it for complaint mechanism as well. For example, let's say um there's some type of violence that happened during the implementation of the project or during the an activity of the project. So people usually use suggestion boxes to put their complaints, or they use the hotlines to like tell their complaint. And then you can use all this information as well for your monitoring evaluation as well. And one other part of as well is like people usually put recommendation in suggestion boxes, or they usually tell you how they are being impacted as well through the suggestion boxes as well. So these are like you're able to kind of like gather certain unexpected outcomes within your project through those suggestion boxes as well. So these are different type of mechanisms that they use, and I wanted to highlight them here with you. And for the evaluation part, this is for the same project that I was working on with my professor. So for the evaluation part, how data collection is planned is like it's really organized, and like it gives you like a broader view of exactly how you're going to implement your evaluation. Like for example, if we go through this here, you do have certain the purpose of the evaluation. For example, you assess the relevancy and the coherence and efficiency impact of the LAIRT, which is the injection. And you are also evaluating like the health outcome, the treatment adherence, and cost effectiveness and implementation challenges or maybe barriers within the project. So you have like a whole scope of like what you're going to do within the evaluation, and you do have your evaluation questions as well to better understand exactly or to better guide your evaluation plan. And from a data collection perspective, what's important here is that the evaluation uses like a mixed method approach, which is like both quantitative and qualitative techniques that are intentionally combined like to provide a complete picture of the project, of the progress of the project. And you'll see that also the data collection is planned to be done in two phases. And the first phase is, which is like the pre-implementation phase data collection, which kind of relies on like secondary data sources like review of medical records and review of needs assessment reports to better understand the baseline context of the project. And in the phase two, during the post-implementation, the evaluation kind of like shift into a combination of like a secondary and a primary data collection, which includes like same thing, basically the review of medical records to kind of assess the change in like adherence of health outcomes. And they do also implement like a survey with like inmates and healthcare providers to kind of like understand how like the project is impacting like inmates or healthcare providers as well. And for that, they're going to use all other like techniques such as like in-depth interviews to kind of explore like the perceptions of the different stakeholders, like the prisoners, maybe donors, healthcare providers as well. And they do have focus group discussions, particularly with healthcare providers and prison staff, to better understand like the challenge and attitudes change within the scope of the project. But one important thing here you can see in the focus group discussion, they put non-inmate stakeholders because as in the beginning of the training, I talk about like sensitive topics and like when you're in a prison system working with prisoners or inmates, that's the word that we use for to refer to prisoners most of the time. Um, when you like discussing sensitive topic, you're an inmate and you're living with HIV, you don't want to put them in a group of with other people just because you're trying to protect their privacy. And that's where like in-depth interview or key informant interviews are really important because you're trying to minimize or reduce the harm that you can put that participant in while you're doing the evaluation. So that's why it's mentioned here, non-inmate stakeholders only, because you don't want to put them in harm. And I think for the evaluation part, compared to the monitoring part, we didn't have observation. But for the evaluation part, we do have observation to assess like the like operational, maybe operational barriers in the prison system and other things that maybe are that might affect actually the success of the interventions that aren't always visible or you cannot really collect through just data collection through surveys or interviews, but just by seeing how people are behaving or how people are using the different like maybe equipment or like you just assess how people are following the protocol. So use observations for that most of the time. Um, yeah, basically that's how they plan. We actually plan the evaluation for this project. And to kind of like summarize this part, data collection techniques are not like I cannot just come and say, hey, we're going to do an evaluation, we're going to do a survey, or we're going to do an interview because data collection is not like a one size fits it all approach. It's like you you don't just like pick a method. The technique you're going to choose should actually match what you're trying to learn from the evaluation and the kind of data that you need also, and also the context in which you're working. Um, um, One thing maybe I must say here is that the method that I put here is like the most common ones that we use in monitoring and evaluation. And you might see something that is really different from that, but it depends on the scope of your project. It depends on the organization and how they want to do it. But as you can see here, I put like surveys. Surveys are like quick and structured and like they are really to analyze. And they are really great when you need to collect numbers and percentage from a large group as well. And we do have questionnaire. I kind of put it on the survey. And the reason why is because questionnaire is really similar to survey, but usually they are shorter and they are more targeted as well. Like when you're asking for feedback from training participants and stuff like that, that you might use some questionnaire. And we do have interviews that are usually like when you want to gather personal stories or have a deeper understanding of like the experience of people through your project. And they are often like a one-on-one conversation that kind of let people explain their own experiences and their own perception about something, their opinions. And the focus group that will help you to understand shared experiences within the groups. You can kind of see how people interact with each other, what they agree or disagree on, and what matters most to them as well. So the focus group will give you like the different perspective of the different people. And we discussed the observation earlier too. It's all about like watching what's happening in real time, how people are like behaving, how services are being delivered, of are they following the protocols and stuff like that. The documentation review, which kind of means like it's like the secondary data collection, which kind of means like using like what already existed and to do your evaluation, like using patients' records, activity logs and things like that. And we do have case studies that could tip into like one example sometimes. They might be using like a group example, like a person example. They explain why something happened to that person or to the group, or why something didn't work for that person or for that group to kind of make their point. And there's the tracking of KPIs as well. Tracking of KPIs is kind of like a type of the documentation review in some way, because they use like performance indicators that maybe data already exists for those performance indicators that you can just use as well for your evaluation. And you that allows you to see how like well the project is doing over time when you like do your usual KPIs. But one thing that we've noticed recently is that it's becoming more common to use certain other methods, which is social media monitoring, that can show us what people are saying, how are they feeling in real time, and it also helps us to understand different trends and engagement online. And certain organizations, mostly for profit organizations that are trying to understand or create new service, they do use customer chat history now, like conversation with support teams, which can reveal like what people are struggling with sometimes. And they're like they actually use them to understand what people are asking for, just in a way to better improve their services. And for this part, I think the takeaway would be like to choose your method based on what you like want to know exactly. Because good M&E starts with like the right question and then uses like the right tools to kind of like get the answers that you want to get through your evaluation. And one important part also when you like collecting data and you are design your data collection tools, you need to ask the right questions. And whether you like writing surveys, interview guides, or focus group interview guides, your question should always be guided by your objectives. Like you need to ask yourself, what am I trying to learn with this tool? So once you have like a clear idea on what you want, um, you will need to kind of like keep your questions very short and clear, and also avoid using technical terms. By technical terms, I mean like if you like collecting data about, let's say, norms, and you like asking questions to a participant saying, do you know if there is like any injunctive norms that exist in this community? They're not going to understand what injunctive norms mean because they don't use those terms in their like day-to-day languages. So you need to kind of explain what you mean by injunctive norm, or you need to exactly mention the norms that you're exploring. You don't just mention the technical terms. Then you have to think whether like you need to ask open-ended question or closed-ended questions. And open-ended question actually help you to explore thought, experiences, or opinions. And an example of open-ended question is how do you how do people in your community consider young girls discussing family planning? So for this question, you obviously going to get like opinions or thoughts about like the way people think of girls discussing family planning compared to close-ended questions that count or categorize responses. For example, do you agree or disagree that young girls should not use family planning methods? The person is going to, or the respondent is going to say, I agree, I don't agree, and they might be able to add to it. But if it's like in a survey, they just have like the option to say, I agree, I don't agree, something like that. Or it might be like Likert scale, like score from 1 to 5 or 1 to 10. It depends on the evaluators. They do specify them the way they want to specify them. And I already said like avoid using technical terms. You also want to avoid leading or ask biased question. And by biased questions, what I mean is like asking a question like, don't you agree this program was very helpful? If you ask someone, don't you agree this program was really helpful? They're gonna be like, yes, it was really helpful. And it's because you're leading them to this answer. So you don't really get a data that is really reliable. And instead of like saying, don't you agree that this program is really helpful? You can actually ask the question, how would you describe your experience with this program? Type of things like that. So that's why we could avoid leading biased questions. And also the language that you're like using, it should feel really natural to your audience. If you like working like with your frontline workers or community members, make sure that like the way you like phrasing your question is culturally and socially appropriate for them as well. And an important part is that you need to test your questions. You need to pilot your interview guides because you might think like you have the best questions and then you go to the community and the community doesn't understand your question at all. And that happened to me in a research project that I was with. We had designed all the questions, and when we arrived on the field, we started asking people some, we were piloting it actually, not like we were actually doing the data collection. When we asked the questions the way we thought people would understand them, people didn't really understand the question. So we had to take notes of that and rephrase our questions to be more culturally appropriate. And in terms of like selecting the right techniques in order to do so, first you need to start by asking yourself, what exactly am I trying to learn? If you like tracking numbers, like rate of participation, test scores, you need quantitative data. Like you can use surveys, you can use record from like attendance lists and stuff like that. But if you're trying to understand exactly like what the experiences of the participants are, what are their motivation or barriers, you most likely use qualitative method in order to be able to do that, or interviews or focus group discussion as well. Use those methods to kind of like get qualitative data for your evaluation. And next is to ask questions about who your respondents are. Are you speaking to community members, healthcare providers, or policymakers? Because the method you're going to use for data collection should make sense to the respondent group as well. And the context really matters, and you have to consider like, do you have time, or do you have enough budget for interviews, or do you need something that is quicker like a mobile survey to get the data that you need? All these are things, these type of questions that you need to think about. And but always remember, if the topic is really sensitive, of course you will need to do key informant interviews. You will need to talk directly with the participant so you can gather the data from primary sources, because if you collect secondary data, you're most likely going to get data that are not reliable and accurate for your evaluation. And also think about your team's capacity, because you need to have people who are already trained in, I mean, they don't need to be already trained. If they are not trained, you can actually train them. But most of the time, depending on your budget, your time, and stuff like that, you would need to have people who are already trained to do interviews and to do qualitative data analysis for you. And also, like, do you have other tools that are available for you to kind of like do your evaluation very quick? These are the tools that I discussed earlier, like Kobo, Toolbox, Sources, and stuff like that. And finally, no matter the method you choose, you always consider the data quality as well. And by data quality, I mean, in order to be able to consider like your data quality, you need to make sure that of the validity of your data, of the reliability of your data, accuracy and completeness. And by this, I mean like you need to like make sure that you use appropriate, culturally appropriate questions, ensure the tools all align with the evaluation objectives, which is for the validity part, and for the reliability part, which means being like consistent, like using the same procedures every time the data is being collected, and making sure like all data collectors are trained in the same way as well, because you cannot train a group of like collectors in a way and the other group in a way, in another way. So your data is not going to be reliable. And for accuracy, you need to kind of minimize errors. Like this includes like being cautious with the data entry, always cross-checking entries and validating unusual responses when possible. Like, for example, if, for example, you're asking a question like about marriage, let's say like you ask someone, are you married? And no, you ask someone about their matrimonial status and you have married, divorce, widow, something like that. And then someone say, oh yeah, I'm married, but traditionally. So this is a response that you didn't have information for in your data collection tool. So you will note that information and then you're going to make, before you actually validate it, you're going to understand what is traditional marriage. And then you can actually put it in your data collectors to have that information available for them in case someone else is saying, yeah, I was traditionally married, something like that. Else is making like sure that you don't have big gaps in your data set. This means like having question, let's say you're using Kobo Toolbox, it's like having questions that people can skip that's going to leave so many gaps in your data collection, in your data set actually. So you avoid having questions that people are able to skip. And if, for example, someone put in information in the survey that is not really exactly what you wanted to collect, that information that you wanted to collect, but you need that information for your data analysis. Make sure that you read the data that you have available, and if the data is not valid, make sure that you are able to follow up with that respondents again and ask the question properly so they can provide the right information that you want to collect for your data analysis. And also have included like a few practical tips that are useful at every stage of that data collection process. And here for instrument design to final like analysis, they are like training your team, piloting the tools, and implementing simple quality checks that can go along the way in maintaining your data integrity and stuff like that. So this is basically like a checklist that you need. Uh, you will always need to refer back to it in the process of your evaluation plan. And And another important thing is like ethical consideration. You will always need to have informed consent, which means like explain clearly what the purpose of the data collection is to your participant, inform them that how the data is going to be used, and emphasize on their right to refuse to participate in the data collection process or in the evaluation, or to withdraw their participation at any time as well without any consequences. Always make sure that you protect their confidentiality and anonymity as well. Make sure that your data is secured, like in a way that people won't have access to it. When I say people, other people that are not authorized on your evaluation or within your organization, they're not authorized to use this data. Don't make sure that the data is not available to them. And avoid harm. And like harm is translated differently. It means like emotional harm, physical harm, and social harm as well to come to your participant after participating in your data collection process. And be really sensitive to topics such as that can trigger distress, which means like, let's say your project is about gender-based violence and you're asking someone about their experience. While you're asking that person a question about their experience of being a victim of gender-based violence, not victim, but a survivor of gender-based violence, you you really need to ask the question in a way that is not going to cause any distress for that person as well. And also be respectful of their of the culture as well. Like adapt your approach to kind of honor like local norms and values, and also engaging with the communities in a respectful and inclusive manner. And again, this is like factors of what you should consider when you're selecting your techniques. You should really consider those factors are like how many question and objective, the resources, your target audience and context, data availability, reliability and accuracy, and also the ethical consideration that we just discussed. So this is just like a checklist that you always need to refer to and things that you need to consider. For example, for the M&A question and objective, you need to consider what are the specific information that you need to answer your evaluation question, the different questions that are required that require different types of data and methods. So you need to consider that. And for example, for resources, some methods take more time, money than people. So you need to understand, do you have that money? Do you have that time? Do you have the people for that method? So you need to consider all that in order to choose the best technique for your data collection. And oh yeah, that was my last slide actually. So yeah, the floor is yours. If someone has a question, you can ask the question now. And thank you for listening to me. I hope I was able to kind of reach your expectation.
Thank you so much, Cassange. I didn't see any questions in the chat, but I did have two. If you were to go back to the slide with the primary and secondary data sets, my first question is in a setting where you have to collect data for primary data and secondary data, is who owns the data in this scenario?
Can you ask the question again? Sorry.
Like who owns the data if you do primary data set or secondary data set? I know who owns it, but I'm not sure if whether or not like the group that is participating knows like who owns what.
Okay, so the primary data is when you do that primary data collection, you as an evaluator or data collector or the organization itself, they do own the data. But by owning the data, that doesn't mean, I mean, the participant owns the data as well, their own data, not just the organization, Because let's say you're collecting data from a participant and then later they don't want you to use this data for your evaluation anymore, you will
Mhm.
need to get rid of this data. So the data is always the the person is always the owner of the data as well. But as an organization, you're collecting this data, you're owning the data, but not the whole organization owns the data,
Mhm.
because the evaluator or the organization or the group that is working on that specific project, they do own the data to use it for the evaluation, but they do own it for a specific time, like a time period. Like they might be owning the data for the next 5 years, 7 years, and they have to get rid of the data after a certain period. But for secondary data, they are usually like data that already exists and they were collected another person had collected that data or another organization had collected that data. They do have informed consent when they collected this data. So you're going to use that information, but you're not going to really need informed consent from the participant themselves because you're using information that is already analyzed, that already get rid of like people's personal information. You're not going to be able to identify that person when you like using their secondary data. So it's not like you will put people at harm, to be honest. So the secondary data is owned by the previous organization or the previous collector that had collected that data, but you just make use of it for evaluation report. So you don't own the data if you're using the secondary data.
And
I don't
I
know if I
will
answered the question.
no, you definitely did. And I will add for secondary data as well. And for if you're using their information, if you're using their data to always source it, um, only because that is like ethically that is recommended if you're going to use anyone's work is to source where it is that you've obtained this data so that whoever is
Exactly.
reading your report, they can go on the secondary source to basically review and
Exactly.
maybe obtain
Review
more
this data as
information.
well.
Yep.
Yeah, exactly.
And my next question for you is, how do you deal with reluctant participants or communities that are not used to providing, or they're not used to the process of like giving feedback for certain services or giving feedback for certain programming that they've received to organizations or individuals. Perfect example is like within the Haitian community, we're not culturally up, I won't say culturally aware, but we're not culturally ready to provide feedbacks for certain projects or anything of that form. How do you recommend others to or maneuver how to work with reluctant communities?
Well, that's where it is really important. When I mentioned in one of my slides, I'm gonna try to bring it. Yeah, in the ethical consideration, that's why it's really important to get informed consent. Like, you need feedback from participants directly, and they're really reluctant. What your job would be to kind of like explain exactly why you need this feedback and explain how it would benefit them personally as well when they're giving you feedback. For example, let's take, for example, because I work in HIV with inmates, I'm going to use that as example. We had a case where someone was sharing their personal information on the media. They chose to do it personally and was kind of like, I'm not gonna say promote the organization that was helping them, but in a way to kind of bring awareness in the community that this organization exists to provide healthcare for who you who are impacted by HIV and stuff like that. So the person decided to put themselves out to kind of give feedback generally on the media for the organization. And after the person signed their informed consent and say, yes, I wanted to do it and I want to do it, and I know exactly why I'm doing it because I want others to benefit from what I've benefited from you. 6 months later, that same person came back and was like, I don't want you to be using my information again, although I know it was important, you know, but I don't want you to be using that information again for to promote your organization or to tell the story, not to tell the work that you're doing in the community. So the only thing we had to do was to think, like, ask the media not to kind of like show that person on TV anymore, even on social media as well that we're showing that person. We had to ask all the media outlet that was using that person information to kind of promote the work that we're doing to stop doing it. And we also had to kind of provide certain like psychological um session to that person because they have been dealing with like distress in the community because they put their information out. So the reason why I'm telling you this is because it's really hard for sensitive topic to deal with those people to deal with people who are reluctant. There is not like an approach that I can tell you like this approach would work if you use it, the person is going to agree to kind of like give you feedback. But it really depends on how the community, the outside community will respond to the feedback of that person. And that's what they are mostly scared of. So to better answer this question, I don't have like an experience of like dealing directly with participants who are reluctant, but I know because I've worked in context of like sensitive topics most of the time in Haiti, I know people are really reluctant to use that information. But one of the things that they always make sure of is like when they are giving you information, is that you're not going to record their names, or if you're taking a videos, they don't want you to show their face, or if they're like writing something for you, they're not going to put information that are like that you're going to be able to identify that person specifically on the information that they are going to provide to you. So this is one way that we deal with it. And one other experience I had in Cote d'Ivoire for someone who had experienced sexual harassment in our project. We didn't really know that happened until like a year or years later. But when we're in an evaluation that we were doing, we were asking question about like experience within the project, and we asked a question about like sexual harassment, and the person just stopped talking to us. and
Mm.
was thinking, and we figured out that something happened, but we needed that feedback as well, you know? And we were like, we are not going to force you to answer, but if you want to put your information on paper or you want to call we had a hotline that they used, I think they called it something, phone there, something in Cote d'Ivoire.
Mm-hmm.
You can call that hotline and share any information that you want to share, but we're not going to force you to do anything. But a week later, we went to our suggestion box and we found the information about sexual harassment. We don't want to associate that information with that person directly because we don't know if that we don't need to know either, you know, but we just kind of like guide them on like different mechanism that you have that they can share information without being like without letting people know who exactly they are, you know. These are ways that and these are ways that we try to kind of like deal with people being reluctant. And that I think that's why suggestion boxes are really important as well to have because it helps people to feel more, you know,
Safe.
sharing information. Yeah, exactly.
Yeah.
Because they are sharing information that are really sensitive and they don't want to be in trouble, especially in communities where mostly women are not like, you know, they don't really have power. The power dynamic, they don't have that. So it's really important for you to give them other mechanism to share their feedback without like putting them at risk.
Mm-hmm.
Yeah, that's what I can say.
Okay, thank you. And again, I'm not sure if anyone else has any question for Cassange. We did go over time. And Cassange, if you do have
Sorry.
time, we will obviously send over the recording as well as the presentation either later today or by the end of this week. And we do have a couple other Island Saturdays happening on April 26th, as well as in May 3rd Saturdays and 4th Saturdays. So if you want to participate, obviously sign up. So to close again, Cassange, thank you. And thank you to all of you who took the time to sit with us on a Saturday morning.
Thank you all. Thank you for participating. I will make sure to send these slides to Debbie so she can share with you. I do have resources that I put in at the end of the slide where you can find other documents that are talking about like techniques to use for monitoring and evaluation. And I put some training sessions that we did about monitoring and evaluation and the TOC that I talked about earlier today. I put that information here. And if anybody, or I also have this summary table about like the different methods that we discussed earlier as well to kind of like explain exactly what they are, their structure, how they are done, and when they are recommended to be used, and the type of data they are allowing you to gather or to collect, their strength and weaknesses as well. So I think this is going to be really helpful. And in case someone wants to reach out to me, you can email me. This is my email address, and I do have my LinkedIn profile in the link as well, in the slide as well. So you can reach out to me and ask questions. I'm not going to ask you to pay for asking questions. You feel free to ask me questions about monitoring evaluation or whatever my experience working in the development field as well. So yeah. Basically, that's it. I will be working on a handbook as well about the different techniques to use.
Awesome.
Um, it will be free. When I'm done with it, I'll send it over to Debbie that so she can share it with you as well.
Thank you. Thank you. Again, thank you for joining. And we hope you enjoy the rest of your Saturday.
Thank you.
Awesome. Bye.